Hey, it's Liberty, and you know I'm always a ball of stress. So Allison is here to help relieve some of that stress. You're with the Women's Hospital, High Point at the Women's Hospital.
Yes, correct.
So what are we going to do today?
Okay, what we're going to do is something called dry needling. That is where I take an acupuncture style needle and we can insert it directly into the muscle, insert different parts of the body. It can help relieve tension and it's with pain.
So I've had acupuncture done before. What's the difference?
So acupuncture is Eastern medicine, and I follow a medical model, more Western medicine. So, for example, I'm not going to be sticking anything in your foot to make your hair grow, essentially. So we're going to do it, if your back hurts, we're going to insert the needle directly into the back. I manipulate the needle in a certain way, and then I also hook it up to electrical stim for that purpose there. We also are going to follow up with any kind of corrective exercise. So let's say if you have headaches or upper back pain, you probably have some movement dysfunction. So we're going to evaluate that because we don't want you to have this treatment forever. We want to get down and fix the problem.
So normally you have like a table someone lays on, right?
Correct.
We don't have that here. So no. I'm going to be on the floor, but that's not normally how it is.
Not normally at all, no. It's a little trigger point there, sister.
I felt it in my arm.
That's your bone right there. So I got your shoulder blade right there. But they took some skin tissue off the back of a rat. Turn your head that way for me. And they looked at it pre and post the dry needling, and they actually saw the tissue expand post the treatment, which is pretty cool. Essentially showing that it relaxes.
I'm trying to stay really still.
You're fine. You're not, if you move, it's not, there's your bone right there. You like that?
I don't know what to say about that. I don't know what this feels like. It's just kind of just like a tiny pressure.
Yeah.
Like I don't feel needles.
Yeah, it's not bad at all.
And then how long does the electrical current go in my body?
For 15 minutes.
Okay.
So research shows anywhere between 10 and 30 minutes is beneficial, so I kind of just cut it in half, and I've seen pretty good results with that.
Chances of gaining superpowers from this?
100%. All right, so I'm going to turn it on, and just tell me when you feel it. We may see some muscle contraction, which would be really cool. Feel anything yet?
Ow, yes. Woo!
See?
It's moving. Oh,
yeah.
Holy cow.
That's pretty cool. We're going to back that off. I would not do that to you for 15 minutes. So.
I mean, like, it didn't hurt, but I felt like I'm not moving my arm. Yeah, like that.
So if you can see right there, we have a good muscle contraction going on here, which is not necessarily something we need to show that the treatment works. It's just kind of cool, you know. Is that tolerable to you?
I mean, it's tolerable, but not for 15 minutes.
Okay, we're going to turn it down.
Does that, like, show how stressed you are or how tight it is?
Not necessarily. I mean, I can kind of take it as feedback to say I was really good at hitting those positions or whatever. Mm-hmm. There's a small contraction right there. Mm-hmm. But anytime, I mean, the whole body is just amazing how it works. You think about the heart as like a car engine. You want to think our muscles just all forms of electrical activity. So when I'm putting current directly into the muscle, I'm bypassing the nerves completely.
Who discovered this? Like, how long has dry needling been a thing?
How it was discovered was they were doing some literature on injections, because sometimes when people get injections, it doesn't always work, right? Sometimes they have more pain afterwards. So they said, why is that? You know, because it's medicine, right? It should work. And what they found was that it's not actually the injected kit. It's not the actual medicine that was making people feel better. It was the needle itself. So they're like, so if we get the right spot with the needle, then that makes people feel better alone without the medicine. So that's when they started to research this a little bit further.
So how long after do you feel results?
With typical acute problems like, hey, I kind of just jacked my shoulder up over the weekend, one treatment and they're almost 100% better.
So I guess everyone's protocol is different.
Yes,
like
ma'am.
Some people need to come almost every day and some maybe just like once a week.
Typically, if we start off and if we're doing like a headache kind of chronic protocol type of thing, I like to see it twice a week for 2 weeks minimum to say if it worked or didn't work. Okay, so if we're not getting results right away, I want to see you twice a week for 2 weeks before you completely write it off and look at something else. You can see she's reddened up there, which is a histamine response. So, normal.
What does that mean?
So let's say histamine response. So anytime like you have an itch, let's say poison ivy, that's a great example of a histamine response right there. You're allergic to the poison. They're all out, by the way. I don't know if you knew that. They're all out. You can see you don't even bleed. Isn't that awesome? No blood.
Wow.
Your body's response to that pain is itching. Okay, it's just kind of this neurological response. Instead of seeing pain signals, you're getting some redness, and you get the itching response to that. So that's kind of a easy example of a histamine response right there. But good release of some local pain meds, changing some hormones. How do you feel?
I feel good.
Awesome.
I think I feel like it's still in me, but it's not. Is that weird?
No, not at all. Normal.
Okay.
Yeah, normal. You might still feel like the current's going a little bit. So, and that
I do. If this side feels different than this side.
Yeah. Hopefully, you'll feel like this side feels looser. Hopefully. If not, you'll just have to come see me.
Okay.